Test.com's Medical Assistant Practice Test. For more practice, check out the complete 750-question Medical Assistant Practice Exam Kit with fully explained answers, testing tips, and more. Medical terminology and anatomy. Question 1. Of the following structures, which would be located in the mediastinum? A. Occipital lobe. B. Aorta. C. Left carotid artery. D. Pancreas. B. Aorta. The mediastinum is the central area of the thoracic cavity. It includes the heart, trachea, esophagus, thymus, and other parts of the central chest. The aorta is the main artery of the circulatory system and starts at the top left ventricle of the heart. The occipital lobe is in the brain, the left carotid artery is in the neck, and the pancreas is in the abdomen. Question 2. The point at which an impulse is transmitted from one neuron to another is A. Nerve center. B. Synapse. C. Dendrite. D. Terminal plate. B. Synapse. The synapse would be considered the point at which an impulse is transmitted from one neuron to another. This is a small gap that exists between the neurons. The nerve center is where there is a group of nerves connected to each other. The neuron consists of projections referred to as axons and dendrites. The dendrite works by bringing information to the neuron. The axons take information away from the neuron. At the terminal plate is where an impulse travels from the neuron to the muscle. Question 3. Which of the following terms is spelled incorrectly? A. Bacterial. B. Bacteriology. C. Bactericidal. D. Bacterium. B. Bacteriology. Bacteriology is spelled incorrectly. It should be bacteriology instead. Bacterial, bactericidal, and bacterium are spelled correctly. Question 4. In a human, urine flows through the urinary system in which order? A. Bladder, urethra, kidney, urethral meatus, ureter. B. Bladder, kidney, ureter, urethra, urethral meatus. C. Kidney, ureter, bladder, urethra, urethral meatus. D. Urethra, bladder, ureter, kidney, urethral meatus. C. Kidney, ureter, bladder, urethra, urethral meatus. In a human, the urine flows through the kidneys, ureter, bladder, urethra, and urethral meatus. Remember, the urine is formed in the kidneys, so the chain starts there. The urine then travels down the ureters to the bladder, and then out of the bladder via the urethra and the urethral meatus. Question 5. Which bone is found superior to the patella and inferior to the ischium? A. Calcaneus. B. Femur. C. Ulna. D. Tibia. B. Femur. The femur is found superior to the patella and inferior to the ischium. This is the upper leg long bone that extends inferior from the ischium and superior to the patella. Question 6. Which abdominal region lies just distal to the sternum? A. Epigastric. B. Umbilical. C. Lumbar. D. Hypogastric. A. Epigastric. The abdominal region that is distal to the sternum would be the epigastric region. There are 9 abdominal regions. The upper 3, right hypochondrium, epigastric, and left hypochondrium. The middle 3, right lumbar, umbilical, and left lumbar. The lower 3, right iliac, hypogastrium, and left iliac. Question 7. Blood flows from the heart's right ventricle into the A. Left ventricle. B. Right atrium. C. Pulmonary artery. D. Pulmonary vein. C. Pulmonary artery. The blood flows from the right ventricle of the heart to the pulmonary artery. This is the only time in the body that an artery carries blood that has been used and is deoxygenate. Question 8. Which of the following terms is spelled correctly? A. Gastrointestinal. B. Gastrointestinal. C. Gastrointestinal. D. Gastrointestinal. B. Gastrointestinal. The gastrointestinal tract consists of the mouth, esophagus, stomach, and then the intestines. It consists of taking food in, digesting it, and expelling it. Question 9. Gas exchange in the lungs occurs in the one-celled air sacs called A. Alveoli. B. Bronchi. C. Capillaries. D. Pleurae. A. Alveoli. The alveoli is a one-celled air sac in the lungs where the air exchange takes place. The bronchi are the two large air passages that lead from the lungs to the trachea. The capillaries are the smallest blood vessels in the body. These carry blood from the arterioles to the venules. The double-layer membrane which separates the lungs from the chest wall would be the pleura. Question 10. If a patient has rhinorrhea as a symptom, this means which of the following? A. Mucus discharge from the nose. B. Excessive tearing from the eyes. C. Excessive drooling. D. Excessive fluid in the ear. A. Mucus discharge from the nose. Rhino is a prefix used for anything to do with the nose, and rhea means flow or discharge. Rhinorrhea is when the mucus glands in the nose are producing more mucus than can be absorbed. Commonly known as a runny nose, it is quite a common symptom. Epiphora is excessive tearing in the eyes. Hypersalivation is excessive drooling. Otitis media causes excessive fluid in the middle ear. Question 11. What is adipose tissue in the body? A. The outer layer of skin. B. The whites of the eye. C. The sac around the heart. D. The fatty tissue in the body. D. The fatty tissue in the body. The term adipose means where the fat cells are stored. The whites of the eye are called the sclera. The outer layer of the skin is called the epidermis, and the sac around the heart is called the pericardium. Question 12. Which of the following would be indicated if a patient came in with arthralgia? A. Trouble swallowing. B. Joint pain. C. Inflammation to a sweat gland. D. A headache. B. Joint pain. Artho means to do with a joint or articulation, and algia indicates pain. This is quite a broad term indicating pain in any joint in the body. Aphasia is the inability to speak caused by a brain injury or stroke. Hidradenitis is an inflammation in a sweat gland. Cephalgia is a headache. Question 13. Which of the following would be considered a part of the large intestine? A. Ileum. B. Transverse colon. C. Duodenum. D. Jejunum. B. Transverse colon. The transverse colon is part of the large intestines, along with the ascending colon and descending colon. The large intestine is considered to be the colon, which also includes the sigmoid colon and the rectum. The small intestines consist of the ileum, the duodenum, and the jejunum. The length of the small intestines can vary from 32 to 34 feet. Question 14. Adipose tissue is made of A. Fat cells. B. Lymph nodes. C. Muscles. D. Skin. A. Fat cells. A person's adipose tissue is made up of fat cells. These fat cells are referred to as adipocytes. They synthesize and contain large globules of fat. These are mainly found under the skin, but can also be between the muscles. Question 15. The prefix Brady, as in bradycardia, means A. Fast. B. Irregular. C. Slow. D. Without. C. Slow. The prefix brady means slow. It is used in terms such as bradycardia, meaning an abnormally slow heart rate. The prefix for fast would be tachy. Exam room techniques, patient preparation, and infection control. Question 16. Of the following, which would a certified medical assistant typically be able to perform when assisting the physician in the exam room? A. Assist with minor procedures. B. Start an IV for therapy. C. Administer medications by the intravenous route. D. All of the above. A. Assist with minor procedures. When a certified medical assistant is assisting a physician in an exam room, they typically assist with minor procedures. Certified medical assistants need to be knowledgeable on the scope of their practice in the state they are practicing in. What a CMA can do varies from state to state. However, they are never allowed to start an IV or administer medications by the IV. These fall well outside their purview. Question 17. When washing hands, the three most important factors include A. Antibacterial soap, length of time spent, and hot water. B. Friction, soap, and warm running water. C. Position of the hands, friction and water temperature. D. Length of time spent, type of soap, and running water. B. Friction, soap, and warm running water. Washing hands in a healthcare facility is considered the most important step in the prevention of spreading infections. This should be done before touching a patient and when leaving the patient's room, and any time the hands are considered soiled. Question 18. In a healthcare facility, which of the following agencies or organizations work to set the standards for the safety of the employees? A. OSHA. B. NLN. C. AMA. D. JCOH. A. OSHA. It is extremely important in the healthcare facility for standards to be set for the safety of the employees. The organization that sets these standards is the Occupational Safety and Health Administration, OSHA, which was created in 1970 to help better the working conditions of employees by providing outreach, education, training, and assistance. OSHA is part of the United States Department of Labor. NLN stands for the National League of Nurses. AMA stands for the American Medical Association. JCOH stands for the Joint Commission of Hospitals. Question 19. When a clinic writes a statement which sets the level of care that is to be provided, it would be considered which of the following? A. Mission. B. Standard. C. Objective. D. Requirement. B. Standard. When a clinic or other healthcare facility writes statements which states or sets the level of care that is to be provided, it would be considered standards or standards of care. The mission statement of the facility basically states who the organization is and sets forth the goals for the care to be given at the facility. The objectives are specific goals and typically addressed along with requirements, but are not considered the standards of care. Question 20. In order for the healthcare facility to comply with the Health Insurance Portability and Accountability Act, HIPAA, each patient is to be given which of the following? A. A list of the employees and their credentials. B. The staff's work schedule. C. Office policies. D. Patient rights and privacy practices. D. Patient rights and privacy practices. According to HIPAA, each patient is to be given a statement of the privacy practices of the facility/clinic. The facility needs to keep on file a form signed by the patient that they received this information. The healthcare facilities do not provide a copy of the staff names and credentials, office policies, or work schedule to the patients. Question 21. Typically, in an outpatient situation, which of the following is the main reason for the visit shown in the admission record sheet? A. The first listed diagnosis. B. The principal diagnosis. C. The secondary diagnosis. D. The primary symptom. A. The first listed diagnosis. Typically, in outpatient care, the reason for the visit is the diagnosis that is listed first in the admission record sheet. On an inpatient basis, the principal diagnosis is used. The secondary diagnosis is only used in an inpatient capacity if it is found to be the more primary diagnosis. The primary symptom is used to help determine a different diagnosis. Question 22. Before making rounds, a medical assistant should be sure that they are carrying which of the following on their person? A. A pen. B. A syringe. C. A glucose meter. D. A change of clothes. A. A pen. When making rounds, a medical assistant should always carry a pen with them. This is used to record any changes in the patients, as well as blood pressures and blood sugars if taken. According to the facility/clinic, these notations may be made on a computer. While healthcare providers may test blood sugar levels of certain patients, it does not require that a medical assistant carry a glucometer with them at all times. A medical assistant should never have a syringe because a medical assistant is not allowed to administer injectable medications, especially through an IV. A clean change of clothes, while not a bad idea, is not the typical. Question 23. When would Korotkoff sounds be evaluated? A. Determining blood pressure. B. Counting respirations. C. Evaluating pulse. D. Performing ultrasonography. A. Determining blood pressure. The Korotkoff sound is evaluated when determining the patient's blood pressure. This sound is heard by using a sphygmomanometer and stethoscope when taking the patient's blood pressure. It is heard over an artery if the pressure is reduced below the systolic arterial pressure. It is not heard when counting respirations, taking a pulse, or when performing an ultrasonography. Question 24. For a medical assistant, which aspect of an exam room practice precedes the other listed techniques? A. Treating. B. Listening. C. Problem solving. D. Procedure. B. Listening. One of the most important things that you can do in the exam room is listen. If you are not listening and documenting each complaint or symptom, then there could be a misdiagnosis. While all of the above answers are feasible, the other three would come as a result of listening. Question 25. Which of the following is important for the medical assistant to do before and after contact with the patient? A. Record their interaction. B. Ask the patient questions. C. Disinfect or wash your hands. D. File a claim with the insurance company. C. Disinfect or wash your hands. You should always disinfect or wash your hands before contact and after contact with the patient. This will help to prevent the spread of disease or infections. While you should always ask the patient questions and record their responses, making sure that you and your hands are free of any contaminants is of utmost importance. While the medical assistant could be involved with the filing of the visit with their insurance company, this would not typically be done before contact with the patient. Question 26. If an infection is nosocomial, it means which of the following? A. Contracted within the hospital. B. Originates outside of the body. C. Contracted by touch. D. That originates from within our own body. A. Contracted within the hospital. Nosocomial means that the infection was contracted while the patient was in the hospital. This type of infection is quite common, and is why it is important to sanitize or wash your hands before and after seeing each patient. Exogenous refers to an infection contracted outside of the body. A nosocomial infection can be contracted by airborne means or by touch. An infection occurs when an organism enters the body and causes it to set up an infection. Question 27. When pathogenic organisms are killed or destroyed, it is called which of the following terms? A. Asepsis. B. Disinfection. C. Antisepsis. D. Cleaning. B. Disinfection. Disinfection kills all of the pathogenic organisms. This process is typically done using chemicals to get the result desired. Asepsis is the absence of microorganisms that cause disease. Antisepsis is when the growth of the pathogenic organisms is inhibited. While this is effective, it does not work against viruses or spores. Cleaning is considered the removal of debris, which helps prevent the spread of dust-borne contaminants. Question 28. If a patient is tested to determine the antibiotics that a pathogen is susceptible to, what type of test is being conducted? A. Sensitivity. B. Biopsy. C. Culture. D. Cytology. A. Sensitivity. If the aim of testing is to determine if a pathogen is susceptible to an antibiotic, it would be considered a sensitivity test. The test to determine the pathogen would be considered the culture itself. The physician's order is typically written for a culture and sensitivity testing. If the physician removes a piece of tissue from the patient to send to be tested, it would be considered a biopsy sample. When the cells are analyzed to determine abnormalities, it is considered cytology. Question 29. A female patient comes into the clinic presenting with pain in the abdomen. The doctor notes that this could be dysmenorrhea. Which of the following best describes this diagnosis? A. Painful menstruation. B. Fluid-filled sac on the ovary. C. A tear or split in the abdominal wall. D. Kidney stone. A. Painful menstruation. Dys means difficulty or pain. Meno means menses or menstruation. And rhea means discharge or flow. Symptoms of dysmenorrhea typically last about 3 days and will occur in the lower abdomen or pelvis area. A fluid-filled sac on the ovary is called an ovarian cyst. A tear or split in the abdominal wall is called a hernia. A kidney stone is called a nephrolithiasis. Question 30. A patient comes into your clinic and is having difficulty breathing unless they are in an upright position. Which of the following is the proper medical term for this condition? A. Menarche. B. Lithiasis. C. Orthopnea. D. Gynecomastia. C. Orthopnea. Ortho is a term that means straight or erect, and pnea means respiration or breathing. Since the individual will have trouble breathing when lying down, he or she may typically sleep sitting in a chair. This condition is usually a manifestation of heart failure. Lithiasis is a condition where the stones form abnormally in the kidneys or the gallbladder. Menarche is the beginning of menstruation. Gynecomastia is an overgrowth of breast tissue in a male. Question 31. If a man comes into the clinic and the doctor observes that he has gynecomastia, it would point to which of the following? A. Swollen glands in the neck. B. Overdevelopment of breast tissue. C. A blood clot in the leg. D. Kidney stones. B. Overdevelopment of breast tissue. Gyne is used to describe anything female, and mastia refers to the breast. This condition is specific to men in that there is an overdevelopment of the breast tissue and the chest looks more feminine. There are many things that can cause this, ranging from steroid use to a hormonal imbalance. Lymphadenopathy is swollen lymph nodes. Deep vein thrombosis is a blood clot in the leg. Nephrolithiasis is the term for kidney stones. Question 32. Which of the following should a medical assistant do while the patient is explaining their symptoms? A. Make eye contact and listen. B. Avoid eye contact and listen. C. Prepare for the next patient. D. Multitask. A. Make eye contact and listen. The most important thing a medical assistant can do when a patient is explaining symptoms is to make eye contact and listen. Many medical assistants will do other things while the patients are talking. This is disrespectful and could lead to misunderstanding of what was said. Anything that a medical assistant does that draws their attention away from the patient while they are speaking would be considered incorrect. Medical records and office supplies. Question 33. If a paper medical record needs to be corrected, which of the following would be an acceptable way to make the correction? A. Erase the portion of the note that needs to be corrected. B. Draw one line through the portion of the note that needs to be corrected and initial it. C. Use whiteout on the incorrect entry. D. Shred that page of the chart. B. Draw one line through the portion of the note that needs to be corrected and initial it. If a correction is needed on a patient's paper chart, a single line needs to be made through the incorrect portion, and then the person making the correction needs to date, time, and initial it. The correction is typically made above the incorrect portion. Information on a patient's paper chart should never be erased, and whiteout is never used. The page would not be shredded. Patient charts should not be destroyed. Question 34. Making a note in one file that a paper is in another file is called A. Cross-filing, B. Indexing, C. Conditioning, D. Cross-reference. D. Cross-reference. Making a note in one file that a paper is in another file is called cross-reference. This is actually a simple system, but is very helpful to clear up where a specific document can be found. Cross-filing is a term that is used most often in politics, referring to the registering of a candidate in more than one political party. Indexing would be making a list of a certain group of things. Conditioning would be the completion of the records. Question 35. Which of the following abbreviations refer to intracranial pressure that might be seen documented in a patient's chart? A. FACE, B. FMLA, C. CVP, D. ICP. D. ICP. Intracranial pressure is listed as ICP in medical terms. If the patient has increased ICP, it can be a life-threatening condition and should be diagnosed and treated as soon as possible. FACE is a tool used to evaluate pain and was developed for children. FMLA is the Family and Medical Leave Act. CVP stands for Central Venous Pressure. Question 36. Computer blank is considered the computer's physical equipment. A. Hardware, B. Boot, C. Software, D. Application. A. Hardware. Hardware is considered a computer's physical equipment. Boot is the term that is used for starting a computer. Software generally is the instructions or programming that runs a computer. An application is a group of coordinated functions for a particular benefit to the user. Question 37. If a medical record is problem-oriented, POMR, this means that each medical condition is assigned which of the following? A. Letters, B. Numbers, C. Time, D. Date. B. Numbers. If a medical record is a problem-oriented medical record, POMR, each condition is assigned a number for tracking purposes. The POMR, as they are called, allows the doctor a better structure for recording their notes. The chronological medical record uses date and time. The alphabetical method is typically used more so on paper records, which tend to take up a lot of shelf space or cabinets. Question 38. Which of the following would describe a medical record that is categorized by date and time? A. Alphabetical, B. Numerical, C. Chronological, D. Terminal digital. C. Chronological. Chronological medical records are categorized by date and time. This is one of the more common types of filing, so that all you have to do is look up a particular day to find the information that you are seeking. Terminal digital filing is the reverse of regular numeric and uses the last digit of the number to sort the file. Alphabetical and numerical systems are typically paper-based and take up more room. Question 39. Which of the following would EMR refer to? A. Emergency magnetic resonance, B. Emergency medical records, C. European medical research, D. Electronic medical records. D. Electronic medical records. EMR stands for Electronic Medical Records. More and more facilities are moving to electronic records because of the accuracy and ease of access. While it could be said that emergency medical records are the records that the emergency room makes, the term is almost always used to refer to the electronic health records. Question 40. Word processing software may be used by a medical assistant to create which of the following? A. Superbills. B. Record of all patients and their addresses. C. Inventory of office supplies. D. Transcriptions. D. Transcriptions. Word processing software can be used by a medical assistant to create transcriptions. Word processing software typically is used with text documents. This would include the creation of a document, editing of a document, and printing of a document. Question 41. A cystoscope is most commonly used by a specialist in A. Endocrinology. B. Urology. C. Gynecology. D. Gastroenterology. B. Urology. A cystoscope is most commonly used by a specialist in the field of urology. This is a thin tube with a light on the end of it that the specialist uses to check the urethra and bladder of the patient. The endocrinologist uses an endoscope. The gynecologist typically uses a speculum. A gastroenterologist uses a colonoscope. Question 42. Which of the following would be used to indicate someone has taken a file from the file cabinet? A. Patient chart. B. Out guide. C. Tickler file. D. Summary form. B. Out guide. The out guide is used to indicate when a person takes a file from the file cabinet. This is a filing system that some healthcare facilities use to help identify and control files and x-rays that have been removed. The removal could be documented in the patient chart or summary form, but this would not be a good system for the tracking of files. The tickler file is a system that helps remind the staff to do something at a future date. Billing, coding, and insurance. Question 43. Before referring a patient to another facility, a medical assistant should be sure to verify the patient's A. Address. B. Income. C. Insurance. D. Transportation. C. Insurance. A medical assistant would need to verify the patient's insurance before transferring the patient to another facility. It is not in the scope of practice of a medical assistant to verify the income of a patient. A home address check may be done, but this is typically done when the patient arrives at the medical facility. The medical assistant will more than likely check how the patient is going to get to the other facility, but the first thing to verify would be their insurance. Question 44. A client would not be billed in which of the following situations? A. Where workers' compensation covers the injury and care. B. Where the patient has Blue Cross. C. Where the patient has no insurance. D. Where there's an indemnity insurance plan. A. Where workers' compensation covers the injury and care. If the client is being seen for a workers' compensation injury, then the patient would not receive a bill. This bill should be sent to the workers' compensation department. If the patient has Blue Cross insurance, no insurance, or indemnity insurance, they would receive a bill. Question 45. A blank must typically be paid by the patient at each visit when services are rendered at a doctor's office. A. Copay. B. Premium. C. Deductible. D. Fee schedule. A. Copay. A copay is a fixed amount for health services set by an health insurance policy. It typically must be paid by the patient at each visit when services are rendered. Most insurance companies have a yearly deductible that must be met before services are paid for by an insurance policy. The deductible is tracked on a yearly basis, but a copay is paid at most visits. An example of when a copay may not be charged would be if perhaps the patient has had surgery and the post-op visit is billed with the surgery procedure. A premium is an amount that the patient pays the insurance company each month to maintain their policy. A fee schedule is a list of amounts that will be paid by the insurance company for procedures. Question 46. When billing for ambulatory care, it would indicate which of the following: A. Use of an ambulance emergency service. B. Assignment of benefits. C. Outpatient classification structure. D. Outpatient services provided. D. Outpatient services provided. If a facility is billing for ambulatory care, it is for outpatient services that were provided. This is any time a patient will not be admitted to the hospital. The assignment of benefits gives the insurer permission to pay the provider directly. The ambulatory patient classifications have the structure for the outpatient classifications. Question 47. If a patient has end-stage renal disease, which of the following acronyms would be used when coding? A. ENSTREDI. B. ESRD. C. End-stage RD. D. ES renal disease. B. ESRD. End-stage renal disease would be listed as ESRD in medical coding. They may also call it chronic kidney disease stage 5, CKD 5. None of the other abbreviations in the list are used in medical coding. Question 48. A pregnant patient's medical chart states EHR 150 BPM. What does this indicate? A. Electronic health record. B. Embryonic hereditary range. C. Embryonic heart rate. D. Mother's heart rate. C. Embryonic heart rate. EHR is the embryonic heart rate. This may also be known as the FHR, or fetal heart rate. The mother's heart rate will be listed as an HR. EHR is also used for electronic health record. However, in this instance, it would refer to the embryo's heart rate. There is no embryonic hereditary range. Psychology and communication. Question 49. Of the following, which would not be considered to be a part of effective communication? A. Message. B. Noise. C. Sender. D. Feedback. B. Noise. Noise is not considered a part of communication. The parts of communication would include content, message, sender, how message was sent, receiver, and feedback. Question 50. Which of the following is the center of the brain that controls fear, aggression, and anxiety? A. Amygdala. B. Cortex. C. Thalamus. D. Hippocampus. A. Amygdala. The amygdala is the center of the brain that controls reflexes and emotions such as anxiety, aggression, and fear. The thalamus controls pain perception and relays sensory information. The cortex plays a role in consciousness, and the hippocampus deals with the autonomic nerve system, memory, and other emotions. Thanks for watching Test.com's Medical Assistant Practice Test. For more practice, check out the complete 750-question Medical Assistant Practice Exam Kit with fully explained answers, testing tips, and more. Question 51. Maslow's hierarchy of needs includes which of the following? A. Money. B. Direction. C. Self-loathing. D. Self-esteem. D. Self-esteem. Esteem is considered to be one of the 5 levels of Maslow's hierarchy of needs. The other 4 would include self-actualization, self-esteem, safety, food and sleep, physiological. Question 52. If a patient acts extremely rude to a medical assistant because their insurance does not cover their visit to the clinic, it would be considered which of the following? A. Displacement. B. Denial. C. Compensation. D. Sublimation. A. Displacement. Displacement is when a person transfers emotions about themselves or their situation onto an external substitute, like slamming a door when angry, or, in this case, acting rude to a medical assistant. It is an unconscious defense mechanism. Denial would be considered when the patient does not believe reality, For example, if they are told they have cancer but continue to believe something else is causing their problems. Compensation would be when a person overemphasizes a behavior such as providing their child with gifts because they have to work and cannot spend enough time with them. Sublimation is also a defense mechanism, but it involves taking a negative emotion and turning them into positive action. For example, if a person is turned down from a job and is inspired to start their own business. Question 53. When a medical assistant is able to listen to a speaker's problem and understand the speaker's personal point of view, it is called A. Nonverbal communication, B. Critical listening, C. Appreciative listening, D. Empathetic listening. D. Empathetic listening. Empathetic listening is when one is able to listen to a person's problems and see from the speaker's point of view. This can be an important part of being a medical assistant. Appreciative listening is when listening for enjoyment or pleasure. Critical listening is when evaluating the message, and nonverbal communication is when there is communication between two people, but no words are used. Question 54. When someone listens for particular things and blocks out what they do not want to hear, A. Full listening, B. Selective listening, C. False listening, D. Listening barrier. B. Selective listening. Selective listening is when the listener blocks out the parts of the message that they do not want to hear. This is not a good listening style, as one needs to listen and respond to the entire message when treating patients. Just because you're hearing something, it doesn't mean you're listening to it. Hearing is just the act of receiving the sound waves. Listening means that you are listening to the entire message and that you are sensing, evaluating, and responding to what is heard. This is called full listening. False listening is pretending to listen, like with a smile or a nod, but you are not hearing anything. A listening barrier is either a cultural, physical, or mental form of interference. Question 55. Which cranial nerve is related to the sense of smell? A. Hypoglossal, B. Olfactory, C. Trochlear, D. Vagus. B. Olfactory. The cranial nerve that is related to the sense of smell would be the olfactory nerve, which is cranial nerve 1, or CN1. The 12th cranial nerve is the hypoglossal, which controls the person's tongue movement. The 4th cranial nerve is the trochlear, which controls the superior oblique muscles of the eye. The 10th cranial nerve is the vagus, which interfaces with the parasympathetic control of the lungs, heart, and digestive tract. Law, ethics, and professionalism. Question 56. A medical procedure cannot be performed on a patient until the doctor obtains blank. A. Confidentiality, B. Informed consent, C. Insurance authorization, D. Vital statistics. B. Informed consent. An informed consent should be obtained prior to a medical procedure being performed by the physician. If this consent is not obtained, the procedure could legally be considered assault and battery. The physician is the person that is ultimately responsible for obtaining the informed consent and should always follow the policies and procedures of the facility when obtaining this consent. Confidentiality should always be observed with any patient, but is not something that would need to be obtained prior to a medical procedure. According to the insurance company, prior authorization may be needed for the procedure, but would not stop the procedure from being done. Vital statistics are not always necessary prior to a procedure being performed. It would be according to which procedure is being performed. Question 57. A medical assistant is at a bar with her close friend, and they get to talking about work. The medical assistant informs her friend that the friend's teacher was in the doctor's office getting checked out for kidney stones. This would be considered which of the following? A. Breach of confidentiality, B. Assault and battery, C. Professional malpractice, D. Slander and defamation. A. Breach of confidentiality. According to the HIPAA, Health Insurance Portability and Accountability Act, which was put into law in 1996, the medical assistant is not allowed to discuss any patient with her friend, much less in a public setting where other people can also hear the conversation. This is a federal law which is taken very seriously, with fines and even possible jail time can be imposed as a result. Assault and battery is when one person touches another with the intent of harm. Professional malpractice would be when there is a failure of the professional to exercise the ordinary professional skill expected, which results in damage or injury to the patient. Slander and defamation would be when a person makes a false and damaging statement about another person. Question 58. Of the following, which would the HIPAA requirements apply to in a healthcare facility? A. Physicians. B. Nurses. C. Certified nurse aides. D. All of the above. D. All of the above. HIPAA stands for the Health Insurance Portability and Accountability Act. This is a federal law that was put into effect in 1996. This law applies to physicians, nurses, and certified nurse aides, along with the other employees that work at the healthcare facility. Question 59. A 17-year-old woman who is married arrives at the emergency department of a hospital with an injured arm. Who must consent to any treatment since this patient is a minor? A. Spouse and minor. B. Parent. C. Patient. D. The parent and the patient. C. Patient. If the 17-year-old woman is married, she would be considered emancipated. In this case, the patient would be able to give consent herself. Question 60. If a medical assistant touches a patient with the intention of harming them, it would be considered which of the following? A. Malpractice. B. Battery. C. Harassment. D. Assault. B. Battery. Battery occurs when a person touches another person with the intentions of causing them harm. The threat of harm is considered assault. Malpractice would be considered the failure of the professional to meet the standards of care or conduct that their profession recognizes. Harassment would be considered when a person subjects another person to remarks, actions, or intimidation. Question 61. If a clinic charges a patient's insurance for treatments that were not done, it would be considered which of the following? A. Malpractice. B. Fraud. C. Assault. D. Embezzlement. B. Fraud. Charging patients' insurance companies for treatments and/or procedures that were never performed would be considered fraud. If Medicare or Medicaid is billed, it would be considered Medicare fraud or Medicaid fraud. Malpractice is the failure of the professional to meet the standards of care or conduct that their profession recognizes. Assault would be considered when one person threatens to touch another person to cause them bodily harm. Embezzlement is when a person misappropriates the funds or belongings of their employer, or, in other words, theft. Question 62. If a medical assistant is blank, it means that the medical assistant performs her duties in compliance with the standards of her job description. A. Dependable. B. Negligent. C. Competent. D. Trustworthy. C. Competent. If a medical assistant is competent, he or she would have the ability, knowledge, and skill to perform her duties successfully to the standards required. Dependability and trustworthiness are important qualities for a medical assistant and are part of being competent, but are different from competence. Being dependable is being reliable. Being trustworthy is being reliable and honest. Negligence is where a medical assistant does not take proper care when performing their duties. Question 63. When hiring a new employee, which of the following forms is needed when they are choosing tax exemptions? A. I-9. B. 1099. C. W-4. D. 1096. C. W-4. The W-4 form is used by the employer to make sure the right amount of federal income tax is withheld. It is recommended by the IRS that a new W-4 form is submitted each year. The 1099 form is used to report other types of income if you had any during the year. The 1096 form is used to summarize the information you are sending to the IRS. The I-9 is used when someone is hired to verify their identity. Bookkeeping and collections. Question 64. If a patient's bill has been unpaid for more than 90 days, which of the following would call the patient? A. Attorney. B. Medical assistant. C. Collection agency. D. Physician. C. Collection agency. Once the patient's bill reaches 90 days or more overdue, it should be turned over to a collection agency to contact the patient. The breakdown for the schedule to address unpaid bills would consist of bill patient, 30 days, call the patient about the bill, 45 days, send letter number 1 to the patient, 60 days, send letter number 2 to the patient and make a call to them, 75 days, send letter number 3, 80 days, should turn the bill over to a collection agency, 90 days. At 90 days, the collection agency should contact the person, not the lawyer, medical assistant, or physician. Question 65. If a medical assistant managing patient payments learns that a patient's check has been returned due to insufficient funds, what step should the medical assistant take first? A. Call the patient. B. Call the police. C. Notify the collection agency. D. Call the patient's employer. A. Call the patient. If a clinic gets a check that is returned for lack of funds, a medical assistant's first action should be to call the person that wrote the check. At some point, if the check is not taken care of, the collections agency or police may need to be called, but it's not the first step. Question 66. What financial record in a clinic is typically the most active? A. Accounts payable. B. Employee payroll. C. Accounts receivable. D. Malpractice liability. C. Accounts receivable. The accounts receivable records are typically the most active records in a clinic. This section covers what the patient owes and pays to the clinic. The accounts payable section would cover what the clinic owes and needs to pay out. When the cash is paid out, it is referred to as disbursements. The employee payroll section is often referred to as the payroll register. Scheduling and office management. Question 67. Good team members, blank. A. Focus on their tasks and not on some lofty goal. B. Do not communicate with or interfere with others. C. Do their job well without helping others with theirs. D. Accept responsibility and accountability. D. Accept responsibility and accountability. Good team members accept responsibility and accountability. They are clear about the goals, and they know that all goals are important. They focus on the goals. Good team members are always ready, willing, and able to help other members of the team within their scope of practice. They also communicate with other team members, and they trust them. Question 68. Once an employee is hired, within how many days does the employer have, by federal law, to have the I-9 form completed and verified? A. 30 business days. B. 14 business days. C. 3 business days. D. Within the first year. C. 3 business days. When an employer hires an employee, they must get an I-9 form filled out. Once this is completed and verified with the proper identification, the employer must have them on file within 3 business days of hire. The employer must keep them for a designated length of time and have them available for government inspection if requested. Question 69. When checking the identity of a patient, most healthcare facilities require that the patient present blank forms of identification. A. 3. B. 1. C. 0. D. 2. D. 2. While it may be possible for someone to forge or fake one document, it is less likely that they be able to reproduce 2. This is why most facilities require 2 forms of verification. Most people only have 2 forms of verification, so asking for any more than that would be redundant. You should never admit someone without checking their identity first. Question 70. If an individual is going to be using a computer for long periods of time, they should do which of the following? A. Adjust the chair height and monitor to a comfortable position. B. Sit as long as you can without moving so you do not break concentration. C. About once an hour, stand and stretch. D. Both A and C. D. Both A and C. You should always adjust the chair so that your feet are planted on the ground. Make sure that your display is adjusted to the point where your neck is in a neutral position. You should never sit for long periods of time while working on the computer. This puts your body in an uncomfortable state, even with everything adjusted correctly. If it is not, it can do damage to your body over time. Question 71. A patient is always late for their scheduled appointments. The office manager spoke to the patient about the issue, but it has not changed the patient's behavior. Which of the following is an appropriate next step? A. Always schedule them at the end of the day. B. Charge them a late fee. C. Force them to find another doctor. D. Have a heart-to-heart talk with them about the situation. A. Always schedule them at the end of the day. If a patient is perpetually late for appointments, the best course of action is to schedule their appointments at the end of the day. This will give them more of a sense of urgency about getting there on time because if they are late, the practice will be closed. The question implies that they have already tried speaking to the patient about showing up on time, so having a heart-to-heart does no good. As far as forcing them to find another doctor, there are many people that have severe illnesses and cannot be without a physician. Charging the patient a late fee for showing up late is not a reasonable action, as there was no work done at the time to charge for. Question 72. What type of booking or scheduling is used if a medical assistant brings multiple patients into the office at the top of an hour to see their healthcare professional and they are seen on a first-come, first-served basis? A. Double booking. B. Wave scheduling. C. Standard procedure. D. Time-specific scheduling. B. Wave scheduling. Wave scheduling is a method where multiple patients are scheduled to see the doctor at the beginning of the hour instead of every 15 to 20 minutes. Patients are then seen on a first-come, first-served basis. This has become a norm at many doctors' offices. You could argue that live scheduling is the standard procedure, but this is not what the process is called. Double booking would not apply in this case because you are not booking two people at the exact same time. Time-specific scheduling would not fit in this case because that is where you have an exact time for every appointment. Question 73. Call screening in a medical office is important because it allows a medical assistant to do which of the following? A. Avoid taking walk-ins. B. Avoid patients that are not emergency. C. Make sure the patient is properly triaged. D. Avoid patients that have caused trouble. C. Make sure the patient is properly triaged. Call screening in a clinic office is typically an answering machine which provides the caller with a recorded message with options on the phone. The caller is then able to leave a message which a medical assistant can later listen to. This is important because it allows the medical assistant to properly triage the patients by priority. The more serious cases would need to see the doctor sooner than the minor cases. A walk-in would not be calling to make an appointment. You should never avoid patients whether they have caused trouble or if they're not an emergency. You still need to speak with them to make sure that your immediate services are not needed. Question 74. As a medical assistant, when a patient calls to cancel an appointment, you should do which of the following? A. Have the doctor call them to reschedule the appointment. B. Inform them that their appointment cannot be rescheduled. C. Tell the patient the office is too busy to reschedule the appointment. D. Process the cancellation and talk to the patient about rescheduling. D. Process the cancellation and talk to the patient about rescheduling. As a medical assistant, you should process the cancellation and speak with the patient about rescheduling. Things happen that cannot be prevented, and the patient may not be able to make the appointment. The doctor will never be involved in making appointments for patients. In some cases, the patient may decide to call on a later date and reschedule. You should never tell the patient the clinic is too busy to reschedule. It may take some time to get them in, but you will always find a spot. Question 75. Which of the following treats a patient that has diseases of the blood? A. Cardiologist. B. Pulmonologist. C. Podiatrist. D. Hematologist. D. Hematologist. A hematologist treats patients that have diseases of the blood, such as hemophilia, leukemia, or sickle cell disease. A cardiologist treats diseases of the heart and vascular system. A pulmonologist treats diseases of the lungs, and a podiatrist treats the feet. Office laboratory procedures. Question 76. calcium, potassium, and sodium are all classified as A. Androgens, B. Electrolytes, C. Estrogens, D. Prostaglandins. B. Electrolytes. Calcium, potassium, and sodium would be classified as electrolytes. There are several others which could include, for example, glucose, ammonia, and magnesium chloride. Androgens would be considered steroid hormones that help with male secondary sex characteristics. Estrogens are a group of sex hormones that play a major role in the sexual reproductive development, especially with women. Prostaglandins are a natural chemical in the body that has hormone-like qualities. Question 77. Which is the term for an abnormally low white blood cell count? A. Anemia, B. Leukemia, C. Leukocytosis, D. Leukopenia. D. Leukopenia. The abnormal low white blood cell count would be considered leukopenia. If a person has a normal white blood count, it would be between 3,500 and 11,000 per microliter. When this count drops to less than 3,500 per microliter, it can be considered leukopenia. If the red blood cells are low, it is considered anemia. Leukemia is a mostly childhood condition, but it can also be in adults with more in men than women. It is also more prevalent in whites than African Americans. Leukocytosis is when there is an abnormally high amount of white blood cells in the body. This condition is common with an infection or inflammatory process. Question 78. In the periodic table, K is the symbol for A. Calcium, B. Iodine, C. Phosphorus, D. Potassium. D. Potassium. In the periodic table, K would be the symbol for potassium. The other answer options are as follows in the periodic table: calcium, Ca, iodine, I, phosphorus, P. Question 79. Which blood type would be considered the universal donor? A. AB, B. O positive, C. O negative, D. B negative. C. O negative. The universal donor blood type would be O negative. This blood type can be administered to patients with other blood types if there is an emergency and there is no time to type and cross-match the patient. The 8 blood types consist of A positive, A negative, AB positive, AB negative, B positive, B negative, O positive, and O negative. Question 80. Blank is a protein in plasma which forms blood clots and stops excessive bleeding during tissue or vascular injury. A. Erythrocytes, B. Leukocytes, C. Reagent, D. Fibrinogen. D. Fibrinogen. Fibrinogen is a protein in blood plasma which causes blood clotting after tissue or vascular injury leads to bleeding. The red blood cells would be the erythrocytes. The white blood cells would be considered the leukocytes. If a solution is added to another substance to help with a chemical reaction, it would be considered a reagent. Question 81. A condition of insufficient blood clotting cells is referred to as A. Thrombocytopenia, B. Thrombophlebitis, C. Erythrocytes, D. Erythrocytosis. A. Thrombocytopenia. Thrombocytopenia would be considered a condition as to where there is insufficient blood clotting of the cells. Thrombophlebitis would be considered an inflammation of the vein. Erythrocytes would be the red blood cells, and erythrocytosis would be an increase in the number of a person's red blood cells, polycythemia. Emergency procedures and first aid. Question 82. Of the following, which would be considered the first step in treating a patient with a chemical burn of the skin? A. Wash with soap and water. B. Apply an antiseptic ointment. C. Apply ice. D. Flush area with water. D. Flush area with water. Flushing the area with cool water should be the first step in the treatment of a patient with a chemical burn. The area should be washed with large amounts of water for at least 20 minutes. There are certain chemical agents that are not to be irrigated with water immediately, such as dry lime, phenols, and elemental metals such as magnesium or calcium oxide. The chemical burn area should not be coated with an antibiotic ointment, washed with soap and water, or have ice applied. Applying ice can cause a frostbite-like effect and cause even further damage. An oil-free moisturizer can be applied for 3 days, but soap is not typically applied to these types of burns. The patient might be placed on antibiotics as part of their treatment if the burns are bad, but the antibiotic ointment is not typically used. Question 83. If a patient has severe burns over more than half of the body, and the burning process has been stopped, which of the following should be the next step in their treatment? A. Starting IV antibiotics. B. Applying antibacterial ointment. C. Administering high-flow oxygen. D. Wound debridement. C. Administering high-flow oxygen. With severe burns, it is important that you start the patient on high-flow oxygen and raise the head to an appropriate height to decrease edema in the airway. The other answers all occur in later stages of treatment. Question 84. If a patient is admitted with a cut that is still bleeding, which of the following should be done first? A. Stitch wound. B. Apply antibiotic ointment. C. Get a tetanus shot. D. Stop the bleeding. D. Stop the bleeding. In this instance, the proper first step would be to stop the bleeding. Typically, this is done by applying pressure. If the bleed is arterial, then surgical repair would more than likely be needed. Once the bleeding has stopped, you can move on to evaluating the cut. The other answers, while all valid, come later in the process. Question 85. If an elderly patient suddenly has an onset of confusion with no previous disorders or symptoms, what would be the most likely explanation? A. Urinary tract infection. B. Dementia. C. Hypoglycemia. D. Alzheimer's. A. Urinary tract infection. A urinary tract infection is considered to be the most common cause of confusion with elderly patients. This type of infection causes inflammation in the person's brain, along with temperature changes. Both of these can lead to cognitive changes in the patient. While all of these answers can cause confusion, hypoglycemia will typically be noted in the medical history. Dementia and Alzheimer's progress slower and should also be listed in the medical history if they are at an advanced stage. Question 86. Which of the following symptoms would a patient exhibit that could be indicative of cerebral edema? A. Abdominal pain. B. Itching. C. Seizures and coma. D. Normal vision. C. Seizures and coma. Cerebral edema can occur from several different types of injuries, such as a motor vehicle accident or a fall. Some of the symptoms could include seizures and coma. In addition, the patient might experience nausea and vomiting, vision that is blurred, and problems breathing. Abdominal pain is not considered a symptom of cerebral edema, but a number of other issues such as gastritis or bowel perforation could be present. Itching is typically a symptom of a reaction, such as to a medication. Blurred vision, not normal vision, could be a symptom of cerebral edema. Question 87. A paramedic informs the medical assistant that a patient has had a cardiac arrest. What does this mean? A. Irregular heartbeat. B. Blood flow interference to the heart. C. Variation in the rhythm of the heartbeat. D. Sudden stoppage of the heartbeat. D. Sudden stoppage of the heartbeat. Cardiac arrest is when there is a sudden stoppage of the patient's heartbeat. This can be caused by a variety of causes such as a myocardial infarction or trauma. An irregular heartbeat could be a sinus arrhythmia or atrial fibrillation, among other causes. A blood flow interference to the heart could be caused by a blood clot or blockage in a coronary artery. Variations in the patient's rhythm of the heartbeat could be caused by several reasons. Pharmacology. Question 88. The pharmaceutical abbreviation QID means A. Every hour. B. Every day. C. 4 times a day. D. Every week. C. 4 times a day. The pharmaceutical abbreviation QID means 4 times a day. Other abbreviations include twice a day, BID, 3 times a day, TID, hourly, Q1-HOU, once a day, QD. This term is not used in most facilities anymore. Question 89. If medication has been ordered by a physician to be taken PC, it should be given A. Before meals, B. At hours sleep, C. After meals, D. Every 4 hours. C. After meals. After meals would be PC. Before meals would be AC. At hours sleep would be HS. Every 4 hours would be QID. Question 90. The pharmaceutical abbreviation BID means A. Once a day, B. Twice a day, C. Once a week, D. Twice a week. B. Twice a day. The pharmaceutical abbreviation BID means twice a day. Once a day is abbreviated to QD. This is not used in most facilities anymore because of the chance of misinterpretation. The term daily is what is typically used now. Once a week is usually Q weekly, and twice a week would be twice weekly. Question 91. If a medication of a patient or resident is indicated as PRN, it is given A. Once a day, B. When necessary, C. By mouth only, D. To discontinue use. B. When necessary. PRN means pro re nata, which is Latin for when necessary. Medications that are given PRN are not on a particular routine schedule. PO is Latin for per os, which means by mouth. QD stands for quag D, which means once a day. DC is the abbreviation for discontinued when in reference to medication. Question 92. All of the following are narcotic or narcotic-like analgesics except A. Ibuprofen, B. Hydrocodone, APAP, C. Oxycodone, acetaminophen, D. Tramadol. A. Ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory that helps decrease the hormones that can cause pain or inflammation in a person's body. It is widely used and is not a narcotic or narcotic-like analgesic. Hydrocodone, APAP, oxycodone acetaminophen, and tramadol would be considered narcotic or narcotic-like analgesics. Question 93. Which of the following classifications of medicine would be helpful in treating the patient that is complaining of heartburn? A. Beta blockers, B. Antacids, C. Analgesics, D. Antibiotics. B. Antacids. Antacids are used to help with the problem of heartburn. There are a variety of medications in this classification that are available over the counter, and at times, the physician will prescribe one that is not over the counter. Beta blockers are used to treat cardiac problems. Analgesics are used for the treatment of pain. Antibiotics are typically used to treat different forms of infections. Question 94. If a patient is prescribed a diabetic agent, such as metformin, which of the following reactions should the patient expect to experience? A. An increase in their blood glucose level, B. A decrease in their blood pressure, C. A decrease in their blood glucose level, D. Vomiting. C. A decrease in their blood glucose level. Diabetes can lead to a patient experiencing a high blood glucose level. If the patient is administered a diabetic agent, they should experience a decrease in their serum blood glucose level. These agents are typically administered either orally or by injections. In emergency situations, regular insulin can be administered intravenously to help bring the patient's blood glucose levels down more quickly. Diabetic agents should not increase the blood glucose levels. An antihypertensive medication decreases the blood pressure. An emetic stimulates the patient to vomit. Question 95. Of the following, which medication would typically be ordered to help a patient get rid of excess fluid in their lungs? A. Furosemide, B. Erythromycin, C. Digoxin, D. Carvedilol. A. Furosemide. Diuretics are sometimes referred to as water pills. There are times, especially if the patient's heart function is not working properly, that the patient may need to be administered a diuretic. Examples of diuretics include furosemide, Lasix, bumetanide, Bumex, and acetazolamide, Diamox. Erythromycin is an antibiotic used for infections. Digoxin is often used to treat cardiac failure and irregular heart rhythms. Carvedilol, Coreg, is a beta blocker used for the treatment of congestive heart failure and hypertension. Question 96. A patient is diagnosed with a blood clot in their left lower leg and is hospitalized. Which of the following would more than likely be prescribed for the patient per intravenous solution? A. Warfarin, B. Heparin, C. Enoxaparin, D. Furosemide. B. Heparin. With this patient, the first treatment of choice would more than likely include intravenous heparin infusion. Heparin is considered to be an anticoagulant that helps the body prevent the formation of further blood clots. After a few days, the patient would likely be placed on enoxaparin, Lofnox, per sub-Q injection, oral warfarin, Coumadin, or another type of oral agent. Warfarin is administered orally, and enoxaparin is administered by sub-Q injection. Furosemide is a diuretic that is typically prescribed to get rid of excess fluid in the body. Question 97. Which of the following would be considered a muscle relaxant that might be ordered for a patient with back pain? A. Oxycodone acetaminophen, B. Hexachlorophene, C. Bismuth subsilate, D. Methocarbamol. D. Methocarbamol. When a person has a back injury, part of the treatment ordered might include a muscle relaxant. Some common types of these could include such medications such as methocarbamol, Robaxin. The nature of the injury will help to determine the treatment, but muscle relaxants are often prescribed. Oxycodone acetaminophen is sometimes ordered for short-term relief with back problems, but typically only if severe. The main treatment would be to determine the cause of the pain and treat that. Hexachlorophene is considered an antiseptic, and bismuth subsilate is considered an antidiarrheal. Pathophysiology and nutrition. Question 98. If the physician prescribes a low-fat diet for a patient, which of the following should they be able to eat? A. Whole milk, B. Chicken with skin attached, C. Cake with icing, D. Boneless, skinless chicken breast. D. Boneless, skinless chicken breast. A physician often orders a low-fat diet for patients that have cardiac issues. With this type of diet, the patient should not eat anything that is considered a saturated fat, such as butter or bacon, for example. They should also avoid whole milk, meats that are fatty, pastries, and cakes with icing. Whole milk has too high of a fat content. Milk should typically be skimmed or 1% according to the directions from the physician or dietitian. Chicken with skin attached should not be consumed on this diet. Chicken is okay as long as it is not fried and the skin should be removed. Cake with icing would not be good because of the fat content in the icing. Question 99. Of the following, which would be considered the correct percentage of nutrient intake by the Dietetic Association for a person's protein intake every 24 hours? A. 15%, B. 65%, C. 25%, D. None of the above. A. 15%. The Dietetic Association says that the nutrient intake of protein should be approximately 15%. According to the Dietetic Association, a person's carbohydrate intake should be approximately 65% and their fat intake should be approximately 25%. Question 100. Of the following, which describes the body's ability to maintain its normal state? A. Anabolism, C. Catabolism, C. Metabolism, D. Homeostasis. D. Homeostasis. The ability of the person's body to maintain its normal state would be considered homeostasis. An example of this would be the body's ability to maintain its temperature. The constructive process in which molecules are turned from simpler to more complex ones is considered anabolism. The destructive process in which molecules are turned from complex to simpler molecules would be considered catabolism. In a person's body, Metabolism would be the sum of the chemical processes and the physical processes, which includes anabolism and catabolism. Thanks for watching Test.com's Medical Assistant Practice Test. For more practice, check out the complete 750-question Medical Assistant Practice Exam Kit with fully explained answers, testing tips, and more.